Hey guys, I'm Dr. Malik, urologist and pelvic surgeon. Welcome to my channel where you can learn everything you ever wanted to know about urology. Today, I'm taking another one of your suggestions and watching some Family Feud. I love Family Feud. It's a great talk show. I'm reacting to urology-related Family Feud clips. I'm excited to watch because I don't really know what I'm going to find, but I'm sure it's going to be very amusing. So make sure if you like what you see to give us a thumbs up and don't forget to subscribe and hit that notification bell so you don't miss my new videos.
On a scale of 1 to 10, how much fun is New Year's Eve?
It's an 8.
Name something people might get too much of.
Money.
Name something people fill with water.
A bottle.
Try again.
A pool.
Name the most popular cereal.
Frosted Flakes.
Name a job that's dirty but someone has to do it.
A plumber.
Try again.
Of course. Dirty. Gynecologist.
His face. Oh my God.
You married, Rocco?
So, gynecology, urology, we are subspecialties of medicine that deal with genitals. So, part of our examination daily is to examine the genital tract, the genitourinary tract. That also often includes a rectal exam. While people may think this is a dirty job, we love what we do because we love taking care of you guys, and this is something that we do routinely day in and day out. Might be a dirty job to you, but not a dirty job to us.
Name something your doctor does to you that he doesn't enjoy any more than you do. Mark.
Sticking his hand in your butt.
His hand?
Sticking his hand in your butt like a proctology visit. Sorry, it's the first thing that came to my mind.
Well, Mark, let me
I don't think he realizes what he did.
let me help you out with something.
Okay.
You mean finger, don't you?
Yeah. Yes.
I'm there right now. That's a whole nother exam if he got his whole hand in there. Buddy?
So, no, we don't particularly enjoy doing unpleasant examinations on our patients. And we definitely don't put our hand up there, so please don't be scared. It's not our hand. And find a female urologist because our fingers are smaller than our male colleagues. So it's a more comfortable exam, for sure.
Hey, how you doing?
Good,
Man?
how are you?
Good. What do you do for a living?
I'm a colon and rectal surgeon.
Rectal. Just the guy I've been wanting to talk to. Let me ask you a question, JB. This prostate exam that I have to go to twice a year. And I'm just curious about the method. You know, with all of the technology that's available to man today, why? Why has no one come up with a simple way that you don't have to lower a man's dignity? It's gotta be an instrument, a machine, something where when I'm bending over, you could just put it on there, click, take a picture, and go, hey, Mr. Harvey, your prostate's just fine. Oh, no. You in here won't talk to you, won't make it pleasant, you won't put a glove on, and you're gonna say stupid stuff. I hate it because you lay on your side, pull your knees up to your chest, smile. I'm not smiling. I hate that. I've had this every way you can have it. And I'm gonna go over the methods with you as the day goes on.
Okay.
But I wanna know why there has not been an invention to make this prostate exam entirely different. Because it's wrong. It's wrong. I wanna take this finger right here I want to push it in your eye right now, JB.
Can I make a recommendation?
You have a recommendation?
I have a recommendation.
I am listening.
Find a surgeon with small hands.
I can't take it no more. This guy is killing me.
Oh, that was so good. Thank you so much for recommending these. That is amazing. We do need to do a digital rectal exam because there are some types of prostate cancer that you cannot detect based on a blood test. So we do recommend PSA screening annually or biannually, meaning every 2 years for patients who are of normal risk between the ages of 55 and 69. So we do recommend PSA screening, but for some types of prostate cancer, they don't secrete PSA. So we still need to do a digital rectal exam to rule out any nodules or palpable abnormalities on your prostate. I know it sucks, but like he said, and like I mentioned earlier, you want to find somebody with not small hands, but small fingers, because I don't have small hands, but I have small fingers. And yes, there are technologies available. We do now MRIs to assess prostates, but it's not a perfect test. It's not to be used in isolation without other tests. We can also do ultrasound, but that's also transrectally, and that's a bit bigger than a finger. So I know it's not fun. I know it's not pleasant. We'll do our part not to say stupid things when we ask you to do your rectal exam. I'm sorry. I'm just sorry if you've had an unpleasant experience, and hopefully your future experiences will be more pleasant.
First, I'm a mother, and I work for Eli Lilly, and I sell erectile dysfunction drugs.
I'm not going to have this conversation with another man's wife, but I am going to have this conversation with her husband. Clyde?
Yes, sir.
You ain't got to buy nothing.
I ain't gotta get nothing. But I don't need it, but I ain't gotta buy nothing.
Of course
I
you
don't
doesn't
need
need
it.
it.
I don't need it either right now, but I tell you what, I pay attention when them commercials come on.
That's right.
You know, at the end, they always give you that warning.
Uh-huh.
If you have an erection lasting more than 4 hours, call
Right.
your doctor.
That's right.
I ain't calling no damn doctor.
You gonna keep working.
4 hours.
That's
4
right.
hours. I'm taking selfies.
Oh boy.
Yeah.
That's right.
Yeah, buddy. With a timer on it. Click, click. That's hour number 2.
Oh boy.
Click, click. It's 3:30. Click. 5 o'clock. I'm still here. Oh, that's so good.
All right, mad jokes, but for real, if you have a priapism lasting more than 4 hours, get to an emergency room immediately. Do not take selfies and do not gloat. You will not be comfortable. I promise. You will not feel good. So please, if you have an erection lasting more than 4 hours, see your urologist or go to the emergency room. The next thing is everyone says they don't need erectile dysfunction meds. Of course, they're on TV. They're going to say that. But a lot of men do. So please do not be afraid to talk to your doctor about needing erectile dysfunction medication because it's a simple, easy thing that can really help you. Of course, we have to make sure that you're a candidate for receiving those medications and you need to see someone who can prescribe that for you. So whether it's your primary doctor or your urologist, you do need to talk to somebody about it. But it's available to you, so don't be ashamed. Ask, use it, have a happy sex life.
Top 5 answers on the board. We asked 100 men, you want a vasectomy? What's the first question you ask your doctor?
How bad is it gonna hurt?
How bad is it gonna hurt?
Do we wanna play? We wanna play.
Let's play. Chris Ann, all right, we talked to 100 men. You want a vasectomy? What's the first question you ask your doctor?
Am I too young?
Yes.
Am I too young? Courtney, you want a vasectomy? What's the first question you ask your doctor?
What are you going to do exactly?
Yes.
Yeah.
That's a good one. That's a good one.
No, that's really a good question. Because I would want to know what is going to happen. I already know what the answer is to that, so it's not going to happen.
Good for
what
you,
are you going to
Steve
do
Harvey.
exactly, sir?
Oh.
All right, we got 2 strikes. We got to be careful. Gender, the class, family can steal. You want a vasectomy. What's the first question you ask your doctor?
How long will I be out of commission?
How long will
absolutely.
I be
Good
out of
question.
commission? Jim, 2 strikes, class can steal. You want a vasectomy. What's the first question you ask your doctor?
Is it reversible?
Is it reversible?
It's permanent. It's permanent.
All right, Josh. 2 strikes, got to be careful. Class can steal. You want a vasectomy. What's the first question you ask your doctor?
Should I have a storage of my specimen?
I don't know what's going to be up there. Because if you're done, you're probably done.
Store up something. You want a vasectomy. What's the first question you ask your doctor?
How much is it going to cost me?
How much?
That's a good question.
Number 5. 3.
Yes, it will. It absolutely will.
Y'all don't understand that.
Okay, guys, that was a really great Family Feud episode. So I talked about vasectomy in my video where I react to Good Mythical Morning, so make sure you check it out. And I talk all about what goes on when you're getting a vasectomy. In fact, the guys on Good Mythical Morning actually video record their vasectomy. So I talk through it, you watch them go through it. It's a great episode, so make sure you check it out to learn all about vasectomy. Kudos to these guys for putting it up on Family Feud. I think that's awesome. I wish they actually talked a little bit about what it was. No one talked about their experience really except for Steve Harvey saying that he knew what it was like. I think he got one, but I'm not sure. So if he did, great job, Steve Harvey. And all of you guys, if you are thinking, if you're done with family planning, consider getting a vasectomy. It's a really straightforward procedure to go through. In fact, some people say getting a paper cut is worse than getting a vasectomy. So definitely check it out. All right, that is all for today. That's all I have time for today. Also, make sure to check out my video about priapism. I actually have 2 videos about priapism. One reacting to Grey's Anatomy and one reacting to private practice. So make sure you check both of those out so you can learn a little bit more about priapism, about the treatment, about what to do if it happens, and what you can expect. Thanks so much for your time today. I really appreciate it. And always remember to take care of yourself because you're worth it.